Hello everyone. In this video, we are going to discuss an important question in modern healthcare and exercise science. What is the role of exercise physiologists in mental health support and recovery? Exercise is no longer viewed only as a tool for physical fitness. Today, strong scientific evidence shows that exercise can play an important role in mental health care, recovery, and quality of life. This video is based on the 2026 ESSA Consensus Statement, published in the British Journal of Sports Medicine. We will discuss how exercise professionals are becoming part of multidisciplinary mental health care systems and why this matters for the future of healthcare. If you enjoy evidence-based sport and health science content, subscribe to the channel, leave your like, and stay until the end of the video. For many years, mental health care focused primarily on psychological and pharmacological treatments. But over the last decade, evidence supporting exercise as a mental health intervention has grown significantly. Research now shows that exercise can produce moderate to large improvements in depression, anxiety, psychological distress, self-esteem, cognition, and quality of life. In some situations, exercise may provide benefits comparable to established first-line treatments when appropriately prescribed and supervised. Importantly, exercise also contributes to social participation, physical health, and overall recovery. This changes the way we think about mental health care. Exercise is no longer viewed simply as wellness advice. It is increasingly recognized as part of evidence-based healthcare. However, despite strong scientific evidence, there is still a major implementation gap. In many healthcare systems, exercise professionals are not routinely integrated into mental health services. This means that many people receiving mental health care still do not have access to structured exercise support. The consensus statement argues that this gap is not caused by lack of evidence. Instead, it is related to healthcare structures, workforce development, policy limitations, and limited integration between disciplines. As a result, several international organizations are now calling for system-level changes that better integrate exercise into routine mental health care. So what exactly is an exercise physiologist? In the Australian system discussed in this consensus statement, accredited exercise physiologists, or AEPs, are healthcare professionals specialized in exercise assessment, prescription, and lifestyle intervention. Their role goes far beyond fitness instruction. They assess physical health, prescribe individualized exercise interventions, monitor responses to training, support long-term behavior change, and contribute to mental health recovery. Importantly, exercise physiologists also work collaboratively with multidisciplinary healthcare teams. This means they may communicate with psychologists, psychiatrists, nurses, physicians, peer workers, and community support services. The consensus statement presents 6 best practice principles that guide mental health care exercise services. These principles are person-centered care, strength-based practice, recovery-oriented care, trauma-informed practice, culturally responsive care, and behavior change support using motivational interviewing. The key idea is that exercise interventions should not be delivered as rigid protocols. Instead, care should adapt to the person's goals, lived experiences, mental state, and recovery journey. The statement also emphasizes that all these principles are grounded in evidence-based practice and collaborative healthcare. One of the most important concepts discussed in the statement is recovery-oriented care. Recovery is not defined only as symptom reduction. Instead, recovery means helping individuals live meaningful, connected, and purposeful lives despite ongoing mental health challenges. This changes how exercise programs are designed. Exercise should align with the person's goals, preferences, identity, and stage of recovery. Programs may also need to adapt over time because mental state, motivation, and functioning can fluctuate. In practice, this means exercise interventions must remain flexible and individualized. The statement also highlights trauma-informed and culturally responsive practice. This is extremely important in mental health care. Many individuals accessing mental health services have experienced trauma, stigma, discrimination, or unsafe healthcare environments. Because of this, exercise environments must prioritize psychological safety. Professionals should avoid re-traumatization and create supportive, respectful, and inclusive experiences. Cultural beliefs, social background, lived experiences, and identity can also strongly influence engagement with exercise. This means that effective care is not only about exercise prescription, it is also about understanding the person behind the program. Another important challenge in mental health care is behavior change. Many people living with mental illness face barriers to exercise participation. These barriers may include low motivation, fatigue, medication side effects, fear of exercise, social isolation, anxiety, or lack of confidence. Because of this, exercise physiologists often use motivational interviewing and behavior change strategies. The goal is not simply to prescribe exercise. The goal is to help individuals develop autonomy, confidence, adherence, and long-term engagement with physical activity. This approach shifts the focus from short-term compliance towards sustainable participation. The statement also explains that exercise physiologists can contribute throughout the entire healthcare pathway. This includes referral, engagement, screening, assessment, exercise program design, delivery, monitoring, review, reporting, and follow-up. In other words, exercise physiologists are not limited to isolated exercise sessions. They contribute to ongoing healthcare management and long-term recovery support. This reinforces the idea that exercise should become integrated within broader healthcare systems rather than remaining disconnected from clinical care. A major theme of the consensus statement is multidisciplinary collaboration. Exercise physiologists work alongside psychiatrists, psychologists, nurses, physicians, peer workers, and community support professionals. This collaborative model allows exercise to become part of comprehensive mental health care. Importantly, exercise physiologists also contribute to physical health screening and cardiometabolic monitoring. This matters because individuals living with mental illness often experience higher rates of cardiovascular disease, metabolic disorders, and physical health complications. So, exercise support may improve both mental and physical health outcomes simultaneously. The statement is important for several reasons. First, it clarifies the professional role of exercise physiologists within mental health care. Second, it supports workforce development and professional recognition. Third, it provides guidance for healthcare systems, policymakers, and service planners interested in integrating exercise into mental health services. And finally, it offers a strong framework that may influence exercise and mental health care internationally. The statement helps move exercise from the margins of mental health care toward a more integrated and recognized role. To finish, let's summarize the central message of this consensus statement. Modern mental health care involves much more than symptom management alone. Recovery-oriented care also includes physical health, social participation, confidence, autonomy, and long-term quality of life. Exercise physiologists contribute through structured exercise interventions, cardiometabolic monitoring, behavior change support, and multidisciplinary collaboration. The statement argues that exercise professionals should no longer be viewed as optional additions to mental health care. Instead, they should be recognized as important contributors to evidence-based, recovery-oriented mental health care systems. If this video was useful, subscribe to the channel, leave your like, turn on notifications, and share this video with students, clinicians, and healthcare professionals. Thank you for watching, and I'll see you in the next video.